Welcome back to another podcast of Simply Medicare. I'm your host, Debbie Stroup, your Michigan Medicare Specialist, and super excited to bring our new guest on today, John. So, John, tell us about yourself and, who is John?
Well, I am 64. I will be 65 in a few weeks. And I heard about the Medicare specialist, that a guy that I golf with, and I've been golfing with him, and I see him once in a while when I do golf with him. He, I seen him about a year and a half ago, and he said, "Oh, I am so glad that I met these people from the Michigan Medicare Specialist." And I said, "Well, what is that all about?" And he said, "Well, I was given this number, and I was given this number that to call when, like, 3 months prior to my 65th birthday, and they will help. They were supposed to help me out and fit me in for the best uh, Medicare insurance they can." So I said, "Wow, all right." I said, "Well, keep that number. When I get close to my 65th birthday, I will ask you a little about it." Another gentleman that I know, great friend of mine, Mark Harris, he turned 65 back in August, and he called a while back, and he said that you guys were just wonderful. You helped him out. He was really nervous and scared and didn't know exactly what to do. He said, "I'm not one to navigate through uh, a lot of insurances." He said, I was pretty nervous and didn't really have to do anything. They did it all for me. They found me a great plan. Um, and all of my doctors were in this network. He said, "So it really worked out well." I said, "Wow, Mark." I said, "Keep that number." He said, "Well, it's the same one Scott has, but I'll give it to you when you get closer." Well, he did. I called. But before I called you, I have what is called Meniere's disease, and it affects the hearing. It affects, I have vertigo, I have loss of hearing, I have a lot of dizziness. So my doctor scheduled me for surgery a little bit earlier, like into October. And so I call my regular primary health provider, and they figured it out, and they said, "Okay, what you're going to owe out of pocket is going to be over $8,000. I said, "That's what I'm going to pay out of pocket?" "Yes." I said, "Okay." So a few weeks later, I talked to you. I talked to Debbie, and Debbie said, "Well, let's see what we could do and how much, if we could get you into a plan once you turn 65, let's see what we could do and see how much it'll cost you out of pocket." And that helped, and it did. It will cost me $246 out of pocket.
How can that be such a big difference?
Well, I guess because I wasn't in the Medicare plan yet, and apparently they just charge a lot of money, and they said, you're going to definitely have to pay this if you decide to go through the surgery. So my surgery isn't it's not an emergency surgery where I have to have it real soon. So when I talked to you guys, you said, "You know what? Since your birthday is January 1st, then it will kick in on December 1st. I said, "Really?" You said, "Yes." I didn't know that. So I am on Medicare now. starting December 1st, and I'm waiting to have surgery January 16th. And I am thrilled with that. And I'm thrilled that I will only have to pay $246.
Mm-hmm. Mm-hmm. Yeah, that's a big difference from 7,000. And
Yeah,
just waiting that little bit so that you're not on that under 65 plan and getting on the Medicare plan made a huge difference. And I'm sure people are asking themselves, how are you only spending $264? Well, that's easy. I mean, you're on the right plan. And
right.
so is your patient is your surgery inpatient or outpatient?
It's it's an outpatient unless there is complications, or I might need to stay a day or two.
Okay. Well, even and because you are in network, you're just paying a flat copay to have your surgery be outpatient. And it's the same for everybody if you're in the right, your plan seems to fit you well. And so outpatient for this plan that you're on is a set amount. Doesn't matter if it's a $7,000 surgery, a $500 surgery, or a $50,000 surgery. You're outpatient, and so an outpatient surgery is just a flat copay. It doesn't matter what it's for or how much the total cost is. So that's pretty awesome.
It is. I'm pretty excited about getting the surgery and only paying the $246.
$36, yeah.
I mean, I would have paid it that amount if it was an emergency surgery. I would have had no other choice. But yeah, I'm in the right network.
Mm.
I definitely owe a big thank you for you and your team.
Yeah.
They worked very hard and they did a very good job. I'm very pleased.
And I think people are really afraid of Medicare. They think it's going to be costly, or I talk to folks all the time, and you may or may not have had this preconceived notion that all plans are the same, or they're going to be really expensive, or, I'm going to be forced to go to certain doctors. And none of that has to be true. It's just simply finding the right plan that fits you, John. And your plan could be very different from, say, your wife's plan or your brother-in-law's plan or your neighbor's plan, because it's important to find a plan where all of your doctors and prescriptions are in network. Wouldn't you agree?
I agree. I agree. All my doctors are in the network. Matter of fact, I went yesterday to pick up 3 of my prescriptions. Um, I had to pay zero for
I
each
love
each
it.
prescription. Yeah, it was great.
Yeah,
Um,
I love it.
so yeah, you can't. I mean, really, it is good. And like you said, I thought I was going to only have certain doctors that I was going to have to see, and it was going to be a short, it wasn't going to be great doctors. I've heard they were not in the network from other people that's told me about Medicare, and they said it can be very expensive. So be very careful. Watch out what plan and providers that are assigned to you. So I am so happy that the Michigan Medicare Specialist worked with me and helped me out.
Yeah, well, we're honored that you were there. And, I hear that all the time. People will say, well, I've heard this, or my friends have told me this. And you may or may not agree with this, but I have found that when you turn 65 or during open enrollment in the fall, everybody becomes a Medicare expert, right?
Right, right.
Everybody's got an opinion. John, you should be doing this, or you shouldn't be doing that, or blah, blah, blah. Everybody's heard something, everybody's talked about something, everybody has an experience. And, correct me if I'm wrong here, but it's really important that you kind of tune out all those well-meaning people and focus on finding a plan where your doctors and prescriptions are in network, as you did. And there's a lot of plans out there that don't require referrals. I've heard that people will say, well, I'm required to see so many, this doctor or that doctor. who's going to require you to do that? And
Right.
if you're hearing that, that's a red flag for me saying, okay, you're probably in the wrong Medicare plan. I don't know. Is that what you think?
Yes, I totally agree with you, Debbie. And especially when you're in the enrollment period, you see on television, you hear it on the radio. There are so many commercials. It confuses the heck out of people. I know it did with me last year uh, in the earlier years. Going, oh boy, I kind of regret going to be turning 65. I'll be confused. I wouldn't know. I really didn't know what I was going to do.
Hmm. And you know what? It's not your job to know. That's my job, or that's anybody that you work with. That's their job, is to help you
Right.
find the right plan. So, what did you do before you retired? What was your career?
Well, I am still working. I am a plumber. I own my own business, and I am still working. Starting in January, I'll be cutting down to semi-retire.
Hmm.
I might work another six months, maybe a year at the most. But I'm going to slow down, maybe 20 hours a week. Um,
Good.
yeah, I'm looking forward to that too.
Well, so here's my point is, I can watch a YouTube video on how to fix my own plumbing. It's not going to turn out well, right?
No,
I mean, it's
no,
not going to turn out well.
absolutely
It's
not.
not going to turn out well.
No.
Everybody becomes a plumber expert, and they're going to
Yes.
say, "Oh, just do this or watch blah, blah, blah," and it's not true. I mean, I would come to you if I had a plumbing issue because I know better than to try and do this on my own. I mean,
Correct.
we've tried to do toilets on our own. You take them out and the flange doesn't fit, blah, 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 and it's like a nightmare. So,
It is.
why is it not acceptable then to say, I don't know what I'm doing with Medicare. I want to work with a specialist. I think very smart people have a difficult time trying to understand it, such as yourself. I mean, it's not what you do. I do this all day long. I live, breathe it. Since 2010, I've been doing this. So it's kind of my job to do it. I'm certainly going to come to you if I have a plumbing issue. I mean, what do you think about
Right.
that?
I think that's great, and that's true what you said, that a lot of people will try to do YouTube on plumbing,
Yeah.
and I get people that I had a gentleman about 3 weeks ago that tried to put in a hot water tank by himself, and his
Oh my
wife called
gosh.
me. Yeah, it took him a day and a half. They still didn't have water, and his wife said she was smelling a little bit of gas. So
Oh
she
gosh.
ended up calling me, and I went over there. I cut everything out that he actually did, redid the whole thing. And he looked at me, he goes, I don't know what I was thinking. I should have called you guys first.
Right. And it ends up probably costing him more in the end.
He did.
So maybe he took time off of work or he had some damage in his
Right.
basement. So it ends up, the thing that I have learned doing this is if it's not my expertise, find somebody who it is. Because one, you're helping local businesses. And
Sure.
two, it's okay to admit that you don't know. I mean, it's okay. So
Right.
that's why we're all out here to, help each other. So, yeah, I mean, I think your plumbing story is spot on because I
Yes,
see that all the time. I'm sure you do in your business where people try and do it on their own. And then I
I do.
I see that too, where people have tried to do their Medicare on their own. And then those are the people that complain, oh, don't do this. This is bad. That's bad. And it's because they're
Right.
just not in the right plan. If you take a pair of jeans, say any name brand jeans, and you say to your friend, oh, those jeans are horrible. And they say, well, why? Well, because they don't fit me right. Hmm. Maybe
Hmm.
you're not in the right size. It's not the name of the jeans. It's maybe you're not in the right size. There are a
Right.
million different types
Right.
of jeans. So
It's
anyway,
not being fitted correctly.
it's not being fitted correctly. And then I think some people think that, plans are very restrictive, like you can't go outside the network or you can't take that with you. Do you plan to travel at all?
A little bit, but not a whole lot. My wife and I, she'll be retired, or she is retired now, but she'll be 65 in another year and a half,
Okay.
and she'll be collecting Medicare.
Hmm.
Definitely, she'll be calling you guys,
Yeah,
and
for
you
sure.
guys will definitely be helping her out. But yeah, there's a few places we would like to go. We'd like to go to Utah. Never been to Utah, so yeah, we'll be traveling a little bit.
A lot of great places in Utah. And I
Yeah.
know, just before we hopped on here, we kind of got word that it's called CMS, Center for Medicare Medicaid Services, are really trying to put a limitation on what us as Medicare specialists can do. They are saying that we may not be useful in the field. And I completely disagree. And I think that you are a prime case of all it was just figuring out that you could start a month earlier than what you thought, and it can save you 7 grand for being in
Oh
not
yeah.
only the right plan, but being able to get your surgery done quicker.
Right. I am so pleased and excited about getting my surgery in January. And yes, when you guys said that I'll be able to start up my plan a month earlier prior to my 65th birthday, I was a little hesitant.
Yeah.
But you
Yeah.
have a wonderful team behind you. You have Tracy, and she helped me through a few of these obstacles, and she said absolutely, you will be able, believe me, John, you'll be able to start it on December 1st. And she
Right.
was correct. I got a letter in the mail, and they told me that, and here I am. I'm on Medicare now.
Yeah. So, we kind of wanted to talk to you about, about this, about working with somebody who is an expert in the field. And it doesn't have to be me. It can be somebody that else out there that is reputable, that lives in your area, that understands where you live and the needs of you and folks around you, versus dealing with somebody that's in nationally or in another country. And I
Right.
think that's what Center for Medicare Medicaid Services is trying to put restrictions on. So,
Hmm.
you telling us couldn't really have come at a better time, because we know that there are so many folks out there that really just need a little bit of guidance and a little bit of a tap on the shoulder, and then boom, they're on their way and ready to go. So I think you're a prime candidate of that.
Well, I'll tell you what, Debbie, that I have two other good friends of mine that are going to be turning 65 within the next 4 or 5 months,
Hmm.
and you'll be seeing them.
Oh, good.
I
I
told
can't
them what,
wait.
what my experience was so
I can't
wonderful.
wait.
Yeah,
Oh, I can't wait.
and I told them about how much I saved in my surgery, and how much that I got Medicare a month earlier prior to January 1st, and they said, really, and how much does it cost?
Right?
That's what
Yeah.
they want to always know. How much is it to hire these people? I said, you know what? It's free.
Zero
Yep.
dollars. Always
I
zero
did
dollars.
not pay a penny. I
Nope.
said, they do all the legwork. You're kidding me. I said, no, I gave them a list of where all my doctors are and all the specialists were. They wanted to see what plan would fit me the best.
Yep.
And they did that.
Yep.
And can't ask for anything more.
Yeah, and I think when people try and research on their own, they are relying on what other people tell them, or they're relying on the name of the company. Well, I think that
Right.
this company is really good. And none of that makes any difference, because we deal with people all the time that are on insulin. And if you just simply pick a plan based on name or what somebody else says, and your insulin, your Novolog, your Humalog isn't covered, guess what? All that money comes out of your pocket. It's really pretty easy. We need to find a plan where every one of your doctors and prescriptions are in network. So, yeah. And plus,
I
it's fun.
agree.
I know people are like, oh, it is not fun. I'm like, honest to God, I love doing this. It is
Yeah.
like a mathematical problem. It's like geometry. If this, then that. And then, you have to go back and take a look at things. So I really enjoy it. And I think you are a prime candidate to share your story about why that's so important.
Well, I am so pleased that I did meet you and your team. And I was, my friend Mark gave me your number. He said that these people are so great. And he got the number from Scott. So
Uh-huh.
it was a trickle down, word of mouth. And it
Absolutely.
was, yeah, it's great. Now I'm going to give you a couple more people plus my wife,
No.
which yeah. So uh, I I had such a great experience with you
Good.
guys. It was great,
Good, good, good. Well, the feeling is mutual. And like I said, we're always here to help you throughout the year. This is not a one and done for us. It's really
right?
important that people, that we continue helping them throughout their Medicare journey. And so, and sometimes that means picking a new plan. And, I remember you brought up about the commercials, and we always caution people, please don't ever call on any of those commercials you see on TV. They are
Mhm.
calling, or you will be calling somebody from another country, which can skirt the rules of the country, of the United States. And then they put you in touch with somebody here. So they've skirted all the rules to keep you safe. So I know the hot topics are, I want a free grocery card, or I want free dental. Those things are important, but they're not nearly as important as finding a plan where your doctors and your prescriptions are in network. Everybody offers the freebies. So that
Right.
comes later, but the most important thing is that. So I always tell people, don't call on the commercials, don't talk to a solicitor, and don't answer any junk mail. Just call your Medicare specialist and work with them, because most of the time they work with all of the plans. And I always tell people, I'm going to tell you the truth about the plan that you saw on television. The reason why they're advertising is because they can't get any business. But if they're on television and they're saying, I'll give you $100 free grocery card, okay, well, guess what? They go and use it and it doesn't work, or their doctors aren't in plan. So it's a complete disaster. So
Right.
thank you for sharing your story. I really appreciate it. I think it's important that people know that there is help out there. So,
Right. Well,
yeah,
thank you for all your help.
it's my
I
pleasure.
Yeah, you guys were
My pleasure.
great,
My
and
pleasure.
you'll I'm gonna be sending a few people your way.
Well, great. We're looking forward to it. We're here all year round, so give us a call anytime. And thanks again, John, for being on the episode.
Okay, thank you for having me.
Yeah,
I was excited about telling my story.
and we're excited about having you. I think it's going to resonate with a lot of people. So thanks
Right.
again. That's
Okay.
not, that's another episode of Simply Medicare. I'm your host, Debbie Stroup, your Michigan Medicare Specialist. We'll see you next time.
If you've enjoyed this edition of Simply Medicare podcast and you don't want to miss any future episodes, please make sure to subscribe wherever you get your podcast. Please also leave comments and offer feedback so we can make this podcast the best it can be for you. If you need assistance with your Medicare sign-up, or you just have general Medicare questions, make sure to reach out to me at 248-227-0347. You can also reach me online at MichiganMedicareSpecialist.com, or through my email at Debbie@MichiganMedicareSpecialist.com. I really look forward to working with you soon.